cavities can be achieved with cervical dilators, but a thick dilator can be inserted into the difficult to access cavity, while a thin one can be inserted. This schematic drawing superimposed on the video frame shows the cavities, bleeding lesions, difficult slope at cavity entrance and dilators. The thin and red one is in the target problematic cavity. Since approaching the difficult to access cavity with an optical system seems very challenging, preparations are underway to widen the ostium for using a curette or Karman cannula. The procedure begins with dilating the difficult to access cavity to a size sufficient for inserting a 5 to 6 mm cannula. Unfortunately, the cannula still cannot enter the difficult to access cavity, which contains the lesion and is directed towards the easier one. As an alternative method, preparations are being made to introduce a rigid dilator into the cannula and use it for directing the cannula. Unfortunately, results cannot be obtained even with a cannula that has a metal dilator inserted and pushed in, because the metal dilator is too short. It doesn't reach the end point of the cannula, and unfortunately, because it doesn't, the few centimeters remaining at that edge stretch and can't fit through the hole, continuing its path towards easily accessible other cavity. To solve the problem, it was decided the metal rod dilator needed to reach the very tip of the cannula so that it wouldn't bend, stretch, or lose its rigidity. For this purpose, the cannula was cut to the appropriate length, the dilator was reinserted, and the procedure was repeated, achieving the desired result. Firstly, measurements are taken first. In such difficult cutting operations, the part of the scissors closest to the joint should be used. The tip should absolutely not be used. The cannula is then cut to a suitable length for the procedure. The metal dilator was reinserted into the shortened cannula. The cannula, forced by the metal rod inside, navigates the bend at the entrance and reaches the target cavity. Now it's time to attach the Karman aspirator to the back of the cannula, unlock the device to activate the vacuum, and begin the scraping phase. After the cannula is attached to the aspirator, it should not be moved back and forth as in normal use. It should only be rotated in a circular manner.